our dear viewers, and welcome to a new edition of our program Africa Today. In today's edition, we are going to talk about the vaccine in Africa and indeed the repercussions of the COVID-19 pandemic on the continent. But first, we'll start from Egypt, where 2.1 million citizens have reportedly been vaccinated against the coronavirus in Egypt. Officials said that the authorities seek to vaccinate 50% of the citizens throughout the year. More details about the latest concerning the vaccine in the following story by Salah Sharif.
Starting the 1st of June, the opening hours for commercial venues were extended amid the coronavirus pandemic, ending a 3-week decision to close these facilities at 9 p.m. Authorities, however, will continue the ban on weddings in closed halls. At a meeting for the Higher Committee tasked with managing the coronavirus crisis on Sunday, officials said the decision allows the addressed facilities to open in accordance with the summer working hours. The summer working hours of commercial shops and shopping malls are set from 7 a.m. to 11 p.m. on weekdays and until midnight during weekends. Coffee shops and restaurants can operate from 5 a.m. to 1 a.m. throughout the week. Authorities will apply fines on violating shops addressed by the decision. These shops will be immediately closed for 2 weeks and will be reclosed for a month if the violation is repeated. Sources told the media that the fine will be 4,000 Egyptian pounds. Weddings will be allowed in open areas only. The decision to close shops and restaurants at 9 p.m. came as Egypt suffered from a significant surge in coronavirus cases and deaths amid the third wave of the virus.
Well, to shed more light about the latest concerning the vaccination in Egypt and Africa, we are very much delighted to have with us over the phone Dr. Magdi Adli, Head of the Medical Financing and Infection Control Department at the Health Insurance Hospital. Good afternoon to you, Doctor.
Good afternoon. Thank you for having me tonight.
Thank you very much, sir, for being with us. Dr. Adli, 2.1 million citizens in Egypt have been reportedly been vaccinated against the coronavirus. What do the numbers tell about the speed of the vaccination process? How do you see that process in Egypt so far, sir?
In fact, Egypt and His Excellency Mr. President Fattah al-Sisi do their best in the field of public health through the creation of a lot of vaccination centers. Now up to 403 or 403 centers to just for acceleration the process and rate of vaccination. And increase the capacity for vaccination up to 110,000 by day. And that number will be increased month by month according to the availability of doses of vaccine.
Yes.
So I see that will be good for pushing the process of vaccine in next few days and next few months.
Yes, indeed. Dr. Adli, also the Minister of Health, Dr. Hala Zayed, said that Egypt will receive about 3.9 million doses of Sinopharm, Sinovac, and AstraZeneca by the mid of June, and added that more than 2,000 liters of raw materials will be provided actually for the manufacturing of the 3 million doses of the Sinovac locally. How do you see that, and what impact would that have on the spread of the pandemic here?
That's a good question. By the way, from the beginning, we blame that to not only for importing vaccines, but also we blame for transmission of or transferring the process of manufacturing of vaccines.
Yes.
So last month or by April, there was agreement between Egyptian government and Chinese side for manufacturing and transferring the technology of manufacturing of vaccines. And by the way, the Egyptian company Vaxera have created a new factory for manufacturing vaccines. And we already have the first batch of raw material of vaccine last month. like 2,000 liters, enough for production of 2 million doses of vaccine.
Yes.
And we plan to manufacturing a lot of doses, cover all the population of Egypt, and
Yes.
then the excess of that doses will be available for exporting to African countries and Arabic countries as well.
Yes, it's very important step actually. Officials also said that the authorities seek to vaccinate about 50% of the Egyptian population throughout the year. How attainable is this from your point of view, Dr. Adli?
This is a good question. I see that, for pandemic, to limit the side effects of coronavirus
Yes.
or the severe side effects of coronavirus, we're supposed to know that we must have vaccinate from 50 to 70% of the population.
Yes.
So if we catch that number, so we will be safe from the bad side effects of that virus, and we delay even the precautional measurements so that we can delay the lockdown and opening
Yes.
the economy another time.
Yes. And we have seen that in many of the European countries which did that after the vaccination. It has started to reopen, and normal life is starting bit by bit.
Hello?
Yes, sir. Sir,
Yes, I'm hearing you.
yes. What percentage of vaccination in society says it is an immune society?
As I told you, at least is supposed to vaccine or make vaccination for
Yes.
50% at least
Yes.
to be in a safe side. But
Yes.
I'd like to add something very important. As the process of vaccination increase, as the number of severe cases decrease and number of death cases decrease, and even we don't see the collapse of health system in any countries as the number of vaccinated people increase.
Yes.
So from your program, we invite people and encourage people
Yes.
to be hurried for registration on the website
Indeed.
of Ministry for registration to take the vaccine. And we're supposed to tell them that the vaccine is very safe and very effective.
Indeed.
You can take it and don't be scared about anything about vaccine.
Indeed. Sir, also many vaccines are expected to enter Egypt, including the Johnson & Johnson jabs. What kind witness high demand, and why is it about the age group, chronic diseases? What are the criteria here?
In fact, in Egypt, we have registered right now four vaccines.
Yes.
One is Sinopharm, second
Indeed.
is AstraZeneca, third is the Russian vaccine, which
Yes,
is
Sputnik.
Sputnik 5, and fourth is Sinovac.
Yes.
And Johnson Johnson is in the way for
Yes.
registration after the taking the authority or after be sure from the Ministry of Health and the Drug Supreme Authority that is from its efficacy and safety.
Yes.
But for the point of choosing vaccine according to the case or according to the history of patient, if he has a chronic disease or not, that one concern with the doctors
Yes,
who
and-
are
yes.
located in the center of vaccination.
Indeed.
They having the report for the case which will be vaccinated,
Yes.
so that there's some vaccine supposed not to be taken with some people having a problem with immune system, like chemotherapy people or people having immune suppressant medicine.
Yes.
So that these people merely take a certain type of vaccine which have a little side effect after vaccination.
Yes. Yes. Sir, what's here your advice for the Egyptian citizens who did not yet register for receiving the vaccination? What's the importance as a doctor specialized in that, Dr. Adli?
First, I'd like to invite first the medical team and encourage them to
Yes.
get vaccine fast
Indeed.
as possible. Then, for people, I'd like to encourage the people to be fast for registration and website of
Yes.
Ministry of Health.
Yes.
So that, as I told you, as the vaccination process increase, we will delay the precautionary
Yes.
measurement, and then the economy will come back to before of pandemic.
Yes, indeed. Dr. Magdi Adli, head of the Medical Financing and Infection Control Department at Health Insurance Hospital. Many thanks, sir, for your very precious input. Always a pleasure to have you with us, Dr. Magdi. And moving on with our reports, where the United Nations said that more than 90% of the people in Ethiopia's troubled northern Tigrayan region need emergency food aid. Samah al-Sharif reports.
As it appealed for $203 million to scale up its response, the United Nations said on Tuesday more than 90% of people in Ethiopia's troubled northern Tigray region need emergency food aid. The UN's World Food Programme said it was alarmed at how the conflict had increased already high levels of hunger in Tigray. The WFP spokesman said a total of 5.2 million people, equivalent to 91% of Tigray's population, need emergency food assistance due to the conflict. Ethiopian Prime Minister Abiy Ahmed, winner of the 2019 Nobel Peace Prize, sent troops into Tigray in November to detain and disarm leaders of the Tigray People's Liberation Front, the region's former ruling party. He said the move came in response to TPLF attacks on federal army camps. Though he vowed the conflict would be briefed, more than 6 months later fighting continues. The WFP said it had provided emergency aid to more than 1 million people since it started distributions in northwestern and southern areas of Tigray in March.
Egypt's U23 football team have started preparations for the Tokyo Olympics. Egypt were drawn in a tough group along with the heavyweights Spain, Argentina and Australia. More details.
Egypt's under-23 team kicked off their preparations for the 2020 Olympic Games in Tokyo by starting a 2-week training camp on Tuesday. The Pharaohs will face South Africa in 2 friendly games on 10 and 13th of June as part of the preparations for the Tokyo Games. Coach Shawki Gharib named a preliminary 30-man squad for the training camp, which includes Galatasaray striker Mustafa Mohamed and Wolfsburg forward Omar Marmoush. Ahli wingers Tahir Mohamed Tahir and Salah Mohsen and Zamalek fullback Ahmed Fattouh were also included in the roster, as were Pyramids star Ramadan Subhi and Zamalek midfielder Imam Ashur. Egypt were drawn in a tough group of the Olympic Games along with heavyweights Spain, Argentina and Australia. The 2012 quarter-finalists opened their campaign against Spain on the 22nd of July before facing Argentina 3 days later and Australia on the 28th of July.
Well, with that, our viewers, we come to the end of this edition of Africa Today. Many thanks for watching.